Thank you, Mr. Chairman. Mr. Chairman, I commend the committee on this legislation, which, if passed by the House and the Senate, will repeal the sustainable growth rate. The SGR has created uncertainty for patients and doctors who serve these patients for years. I appreciate the hard work you and your staff have put into this bill. We must take, however, additional steps to ensure that small independent practices have a place in payment reform beyond the SGR. CMS has provided alternative payment model options for large provider organizations such as ACOs. However, all the options provided encourage consolidation and sets up a process where the independent physician's practice loses his or her autonomy. We must empower independent doctors to coordinate care, improve quality, and reduce cost without sacrificing their independence. We must also recognize that sometimes specialty doctors act as principal care providers. One example, the Sharp Community Medical Group in San Diego has a comprehensive back pain program called SpineZone. Their entire patient population has chronic back pain, and SpineZone focuses on managing the unique needs of this population in a way that increases quality and decreases cost. 2010 data show, I am told, that not only did SpineZone alleviate pain and improve productivity for their patients, but also reduced healthcare expenses by 25% compared to similar back pain cases. I emphasize that they improved productivity for their patients able to restore to normal life activities. That's what we want to do. We must recognize specialists as principal care providers. With these concerns in mind, I will shortly be introducing a proposal that protects the independent payment physician practice and allows both primary care providers and specialists to act as principal care physicians for their patients. My bill, the Small Group Practice Preservation Act, will allow independent principal care physician practices to financially gain from providing better coordination and quality to their patients. Third-party contractors with access to CMS data would provide the necessary tools to empower physician practices to manage their populations most effectively. We received much positive feedback on this concept so far. We look forward to continuing to build support. Mr. Chairman, I appreciate you and your staff working with us on this concept, and I look forward to continuing to do so. I yield back.